So if you have a diagnosis of prostate cancer, the next stage is to find out, is it contained within the prostate or has it spread throughout the body? We call contained prostate cancer localised prostate cancer, and we say when they've spread that they're metastatic. There's a middle group as well where the cancer is broken through the shell of the prostate but still hasn't spread any further afield, and they're called locally advanced. So if one has a diagnosis of prostate cancer, how do we classify it? Generally, we classify it into low risk, intermediate risk, and high risk. Low risk is where the PSA is less than 10, the Gleason score is 6, and the clinical stage or the feel of the prostate is T1 or T2A, meaning that only a small lump is able to be felt or no lump at all. These cancers do not require any further investigations, as the chance of finding anything on tests such as bone scans and CAT scans and MRIs are extremely low, in fact less than 1%. The next group are the intermediate risk prostate cancers. These are people whose Gleason score is 7, whose PSA is between 10 and 20, or whose clinical stage is bigger than a small lump. If either one of these apply, then we call it an intermediate cancer, and people with intermediate cancers do need investigations, including a bone scan, and possibly for higher grade cancers, such as the Gleason 8 to 10s, a CT scan of the abdomen and pelvis, and possibly also an MRI of the prostate to assess the extent of the cancer. And then finally, there's the high risk group. A high risk group is defined as people with a Gleason of 8 to 10, where the cancer feels outside of the shell, a so-called clinical T3, or where the PSA is greater than 20. In these people, there's a much greater chance that there's some disease beyond the prostate. Yet, it's still possible to cure people with high-risk prostate cancer. So, up to 40 to 50% of people, even with these high-risk characteristics in modern series, can be cured. But they often require what we call multimodality therapy, such as surgery and radiotherapy, or complicated mixing of hormone therapy and high doses of radiotherapy to cure them. So each one is managed differently. The high-risk group definitely needs all the investigations. They need the bone scan, the abdo-pelvic CT scan, and they need the MRI, because this helps in the management and often tailors the management in these patients. When deciding on a treatment, using these categorizations, low risk, intermediate and high risk, can help tailor the therapy to the patient. It's clear that many other factors need to be taken into consideration besides the tumour, and these factors might include personal priorities, the size of the prostate, your life expectancy, your general health, local factors, geographical factors, and many, many other factors. But the tumour factors probably remain the single most important determinant of treatment. I can strongly recommend our DVD, How Do You Choose?, to help you tailor the therapy using these tumour factors and many other factors to help tailor and personalise your treatment so that you get the right treatment for the right patient at the right time.